Hi, my name's Andrew, and I'm going to be performing a fundamental exam of the lower extremities on my patient Margot here. All right, Margot, so the first thing we're going to do is analyze your gait. So if you can stand up for me.
Okay.
And if you just stand right here and walk to the wall and then back for me. So I'm just looking at the symmetry, and if there's any abnormalities, everything looks very symmetrical, and I'm not finding any abnormalities. With that, okay, now I'm going to look at your posture. So if you can just stand normally for me. And I'm looking at the neck, shoulders, the back, her hips, her knees, and her ankles from all views. It looks like she has a little bit increased lordosis in her lower back here, but everything else looks very symmetrical. Good job, Margot. All right, can you face the wall for me? Okay, is it okay if I touch your pelvis back here?
Yes.
Okay. All right, and I'm just checking for symmetry bilaterally. Will you flex down for me? Try to touch your toes. All right, come back up. Okay, everything feels pretty good. Now I'm going to test your range of motion, and I'm going to apply a little overpressure with it, okay? All right, can you go ahead and do the same thing, touch your toes? I'm just going to, wow, you are very flexible. Any pain with that?
No.
Okay, now can you cross your arms for me? Okay, and can you extend backwards as far as you can? I'm going to apply a little overpressure. Good. Okay, now can you rotate to your left for me? All right.
Right, that's my right.
Oh,
is that okay?
You're right, yep. This is good. Any pain with that?
Nope.
Okay, and now the other side, to your left or your other right. Any pain with that?
Nope.
Okay, and can you side bend like this?
Yep.
Just gonna apply a little overpressure. Any pain?
Nope.
Okay, and then the other way. Good. Any pain with that?
No.
All right. Now can you face me, Margot? Thanks. You can done crossing your arms. Now we squat down as far as you can go for me. Good. Any pain with that at all? Okay.
No.
And now we're going to come over here, and we're going to do what's called a heel raise. So we're going to bring our heel up off the floor, and we're going to try to do this 25 times.
Okay.
And I would test on both sides. You don't have to do it. This is just for an example for
Okay.
this video. And then I'm also going to do so can you just stand on one foot for me? Cross your arms, and then close your eyes.
Okay.
And we're going to try to do this for 30 seconds on both legs as well. Okay, good. Can I have you sit up here for me? So now I'm going to be testing sensation, okay?
Okay.
So just let me know if you feel anything and if it's the same on both sides, okay?
Yep.
Okay. Okay. Any differences with any of those? Okay, good. So now I'm going to test your strength of your legs. So can I have you bring your leg off the table for me? Okay, and hold it there.
Okay.
And don't let me push you down. Very good, very strong. Can you kick your leg out to my hand? Good. Okay, now kick it out again, and don't let me move you. Good, very strong. Okay, and we're going to bring your heel underneath the table. Okay, and don't let me move you out. Good. Can you bring your toes all the way up to the ceiling? Don't let me move you. Very good. And then get that big toe up there, and don't let me move it down. Good. And then I'm just going to try to move you inward, and don't let me do that. Let me move you. Good. And then I'm going to try to move you outward. Don't let me. Very good. Okay, great. 5 out of 5 on your strength, so you're very strong. And I would test that bilaterally on both legs. Now I'm going to do your reflexes. So this is your patellar tendon reflex. Okay, very good. I'm going to get down. Good. And I would test on both legs as well. Now, can I have you lie down for me? just a little bit. Can I have you uncross your legs for me? Thank you. So now I'm going to do the straight leg raise, which is testing your hamstring flexibility. Wow, you really are flexible. And then I'm going to come down. Any pain with this at all? Okay. I'm going to try to sensitize neural tension by dorsiflexing the ankle. Any pain with that? No. No? And I would do that on both legs. I would do all these tests on both legs, it should be stated. Now I'm going to do the sinus buttock. So I'm going to go all the way in. Any pain with that? No. No? Okay. Just going to test your internal or your external and internal rotation. Okay, very good. And now I'm going to do the quadrant scour. Any pain with that?
Nope.
No? Okay. And now I'm going to go into what's called the Faber. Any pain with that? No? Okay. Now you can just extend your legs, and this is called a log roll, which is testing rotation as well. Very good. Any pain with any of those tests, Margo?
Nope.
Good. Now we're going to talk a little bit about that tummy, okay?
Okay.
So we're going to practice what's called the abdominal draw, which is basically bringing your belly button down to the table, okay? And another way to think about it is if you're trying to get on those really tight jeans for the hot date night, and you don't want to, pinch anything. You know how you kind of squeeze in. That's what we're going to try to do. Okay. So what you can do is if you place your finger right there.
Okay.
Is it okay if I palpate over here?
Yeah.
And then we're going to try to bring that belly button down into the floor. Very good. It's very subtle, but do you feel that?
Mm-hmm.
Great. Perfect. And that's the abdominal draw.
Okay. Thanks.
Now we're going to test your abdominal endurance.
Awesome.
So we're going to bring our arms like this, and we're going to come up, flex up to my hand as much as you can, and I'm just going to time you here, as long as you can go. How long can you go? I'm just joking. I won't make you do it. But I time that, and then you could use that as an outcome measure later on for treatment. And now I'm going to have you go to your side. Can you go on your, your left side, I suppose? Yep. All right. You bring this leg up for me. Good. And don't let me push you down.
Okay.
Very strong. 5 strength right there. And then I'm going to come out here, the same thing.
Ooh, that's harder.
It feels harder? Well, you're just as strong. So very good. And now, just relax for me. Just relax. I'm going to do what's called the Ober's test, which is testing the flexibility of your IT bands. All right. Very good. And now we are going to do, have you ever heard of a plank?
Yep.
Do you do them very often at all?
Sure.
Okay, so we're going to get on our stomach, get on our elbows, and we're going to bring these knees up. Okay, can I have you bring your hips down a little bit for me? Oh, a little too far. Good. Then we're going to look over here to the edge of the table.
Okay.
And we're going to hold for as long as we can. All right, very good. Thanks so much, Margo. You're looking great.
Awesome.
So I'm going to palpate the SI joint and the spinous process of the sacrum and have her lift up her left leg for me to her chest. All right, thank you. Then I'm going to switch and have you lift up your other leg for me. Thank you very much.